That's good, thank you. So can I start by thanking you for the honour of being able to join you at this really important seminar, and to congratulate the Centre for Bioethics and Medical Humanities for the work that it's been doing over such a long period of time, and this critically important contribution that it's making now. And especially to thank Professor Sophia and Professor Yati for the invitations, and also Doctors Erlina and Wicker for moderating this session. So it's a very great pleasure to be with you. These are my disclosures. I'm a philosopher, clinician and researcher, and I'm a physician at Monash University, and I work, as you've heard, in areas of ethics. I'm going to start with just a few quick slides about the Australian experience of COVID-19. We're in the middle, or rather towards the end, of a second surge in Victoria, where I live. Here's a table that shows how Australia compares with Indonesia and, for reference, the United States. We've got a much smaller population, of course, and so the number of cases is small, but we've had a significant number of deaths, which on a population basis is comparable to Indonesia, but about 1/20th the death rate of the United States. Of course, the testing rates are important for the diagnosis, and Australia and the United States have significantly more tests than Indonesia, as a result of which one might expect that they would have identified more cases. This is the pattern that we've experienced. The first wave came in March. It was mainly cases imported from outside, and we got it quickly under control. And then, tragically, there was a second wave, which was much worse, concentrated in Victoria, the state where I live. And we're now at the tail end of it, after there've been about 600 deaths, mostly amongst aged people living in aged care. So it's a very sad and tragic situation for us. We're currently in Victoria, or at least in Melbourne, in what are referred to as stage 4 restrictions, and we're in the 7th week of those at the moment. That has a curfew between 8 p.m. and 5 a.m. that should read, where people are limited to within 5 kilometres of their home. They're allowed to leave for 1 hour a day to exercise or do food shopping. And there are exceptions for people who work in healthcare and other essential services. So I'm allowed to go backwards and forwards to the hospital, but otherwise I'm limited to these conditions. So it's pretty rigorous, and luckily it's worked, and this is really what's happened. The stage 4 restriction, this is the number at the 14-day average here. We're right down, we're actually even lower. We had a good day today with only 28 cases. The maximum of the 14-day average was 400 cases a day, and the stage 4 restrictions came on about here as the numbers were rapidly rising. And as you can see, the very rigorous quarantine, lockdown, curfew rules actually work, and they've really brought it under control. So we're looking forward to the restrictions being lifted. As you've heard, I'm the chair of the editorial board of the Journal of Bioethical Inquiry, and we've produced or we're halfway through producing a special issue on the ethical implications of the COVID-19 pandemic. We've referred to this as Inside the Pandemic, because what we're interested in is the way in which people respond to ethical issues as they have emerged in the thick of the emergency. So these are new issues that we've never experienced before. Many of us were trying to devise new protocols and techniques, not really knowing what the risks would be. So this is really a new ethical situation that's presented a lot of challenges. We put out a call for articles, and we received more than 70 very high quality articles, one of which is from Professor Komesaroff, who's I think attending this meeting, and thank you for your fabulous article. We have grouped them under these 7 headings to give you an idea of the different clusters of ethical issues as we see, as I'll describe as I go along. There are some large-scale overviews of the issues, but there are issues relating to society, there are issues relating to global perspectives, including climate change, environment, and so on. There are different approaches from people in different geographical locations and with different personal experiences, including Indigenous populations, people from different cultural groups, and so on. There are the more formal and conventional bioethical debates, some of which we've heard about already, and I'll refer to those in a moment. There are the more direct clinical implications and the concerns about the impact of COVID-19 on the way in which we manage our patients and the experience of end-of-life care and so on. And there's been a lot of concern about the imposition of restrictions on personal freedoms and limitations of human rights, which formed a separate category. So this is an overview, if you like, of how we see the wide array of ethical issues presented by the pandemic being classified. There are many issues that are familiar here, ones that we deal with in settings in perhaps everyday life. Questions relating to the obligations of doctors in times of crisis. Questions regarding resource allocation and how we decide who has access to scarce resources, limited numbers of ventilators, for example. There's the impact of the strict quarantine restrictions, both on individual patient care and on the lives of community members. But there are also some novel issues. The rapid expansion of police powers is something we really haven't experienced previously in Australia, and it stimulated a very vigorous debate about the limits that are possible under such circumstances. This relates to the curtailment of individual liberties, the use of big data, electronic surveillance techniques, and so on, in order to facilitate contact tracing. And as a result, as we've seen, not so much in Australia, but we have seen it, but especially in the United States, where the pressure of the crisis has really exposed some very deep social and cultural divisions, so much so that it's really put at risk the coherence of the American polity. So there's some very big challenges. There's been a lot of discussion about an inquiry into the origins or causes of the pandemic that was stimulated, and especially by President Trump in the United States. I believe that we really do need to understand the causes, but not in a politicized way, but in the sense of trying to understand why it has been occurring over the last 30 years or so, that there's been an increased number of zoonotic infections, starting with HIV, continuing through the various coronavirus infections, Ebola, the various flu infections, and so on. This has become more common, and it's become accepted that this is a reflection of the effect of the large-scale global effects of the world economy on the environment, on climate change. So the real cause here is not a wet market in Wuhan, but rather a global process for which we are all responsible. And there's the challenge of how to respond, not just to the environmental crisis, but to the ongoing threat of a pandemic. how do we actually now, knowing what we understand, knowing what we know at this stage about the pandemic, about its threats, and about its very profound and devastating implications, how do we transform the global economy and power structures in order to extricate ourselves from the predicament that's now been exposed? I'll say a few words about the search for a vaccine, because this raises some very important issues that I think are worth considering. Everyone recognises the critical urgency of developing a vaccine, and that clearly is widely accepted as being the only way we're really going to get control of this particular epidemic. But because of the urgency, there's been a lot of pressure to speed up the process of developing vaccines. Typically, it takes 10 to 15 years to develop a vaccine, and the criteria for safety and efficacy are extremely high. It's easy to see why the conditions for safety are much higher for a vaccine than they are for a therapeutic agent under normal circumstances, precisely because they're given to millions, or in this case, billions of healthy people, so that even a very rare, serious adverse event may cost many thousands of lives. So there are really serious risks associated with cutting corners in the testing process and of speeding up the process without really taking the time to ensure that efficacy and safety are properly assured. There are real risks here too, that if we don't do this properly, the large numbers of people in both developed and developing countries who are opposed to vaccination, or at least suspicious of it, will be opposed to this one too, but maybe also to other vaccines, to measles vaccine, to vaccines against rotavirus, against dengue, if we can find an effective vaccine, and so on. Vaccination has been exceedingly important in saving lives, and we don't want to undermine the great achievements that have been achieved, that have been accomplished over a long period in relation to other diseases. So we do have to be careful. And the serious implications of the commercially driven process in the United States also need to be understood. Operation Warp Speed, initiated by President Trump, focuses on the commercial incentives, and literally billions of dollars have been paid to pharmaceutical companies to try to speed up this process. As a result, we've seen selective reporting of data, we've seen release of information in order to elevate share prices that have very little to do with the actual scientific endeavours. So this is a process that may actually lead to the compromise of science and to medicine as well. So these are to shift from our usual practices of science and medicine, which are focused on a fundamental ethos of science as being devoted to truth, that is widely shared and is presented for the benefit of the global community. This is now being challenged by the way in which the search for the vaccine is being pressed. And as with the anti-vaccination argument, there's the risk that this process may actually undermine public confidence, not just in vaccines, but in science and medicine more generally. Before finishing, I'll just say, I'll make a point that although clearly the COVID-19 pandemic is a terrible disaster, and it's led to awful tragedies all around the world, it's important to recognise that it's not been all bad. There are some good things that have happened. Some of these are relate to what we're doing today, simply raising questions in the way that we're doing it now, being able to focus our attention on fundamental ethical issues and to refresh our values in the way that that seminars like this can help us achieve, is a positive accomplishment. But also, as we've been able to see from the way in which the pandemic has developed and expressed itself in different countries, we've been able to bring to visibility inequalities and injustices that may not have been formerly so apparent. An example of this is, of course, the Black Lives Matter movement that originated in the United States and has spread around the world. In a sense, we might regard this as a positive accomplishment of the COVID-19 pandemic. In addition, there are many examples, many inspiring examples of selflessness, generosity, forgiveness, community service, personal courage that all of us have heard. Communities pulling together to support their vulnerable members, to take care of elderly people, to bring music and dance to communities that are under lockdown and so on. So in some ways, in some places at least, the pandemic has been able to bring people together in a very positive way.
You almost ran out your time.
I'm just about to finish. Thank you. There are some unresolved questions, and I'm just here listing them for your to stimulate further discussion. What are the long-term consequences here for relations between countries, across cultures, about the natural environment, political systems, structures of the life world? Is this the end of globalization? Will there be other pandemics? What will be the effects on social life, on sexuality, on structures and processes of dialogue? What about the impact of our understanding of the importance of disadvantage and inequality? Will that translate into economic and social unrest? Will the individual rights and freedoms ever be fully restored? And finally, how will our children and our children's children look back on the pandemic? Will they see it see this as a time of learning and progress, or will it be a turning point in the wrong direction towards loss of freedoms, the end of democracy, the final step in the destruction of the global ecological balance? So just quickly in conclusion, what I've argued is that the COVID-19 pandemic is an unprecedented event that raises multiple issues with ethical, social and political consequences. Some of the issues are familiar. They're ones that we talk about in the bioethical world all the time, but there are also novel ones. Questions regarding existential issues, about cultural values, about the threats to science, and about our responses or our ability to respond to climate change. And as I've said, all this is bad, all this is difficult, but not everything is bad. There have been some good things too. Thank you very much for your attention.